What about issues of the tolerability of these immune checkpoint inhibitors? What are your impressions of, are they really trivial toxicity compared with conventional chemotherapy? Are there issues with patients who would really not be great candidates for chemo being treated with immune therapies, potentially with challenging consequences if they have any toxicities? Have you seen that, or are you hearing about that in patients being admitted, with complications who you think might not have been great candidates?
So it doesn't seem that the elder patients or the poorer performance status patients are having worse toxicities. Mm-hmm. In fact, in my experience, it's easier than chemo. People leave and sometimes they come back, are you sure you gave me something a few weeks ago? If patients don't have toxicities, these drugs are far superior to chemo. Mm-hmm. They don't leave people feeling tired or down for 4 or 5 days after treatment. But in those patients that develop pneumonitis or colitis are the two really big toxicities that seem to have a big impact on quality of life. If people's thyroid stops working, it's easily fixed. Mm-hmm. But those can really have an impact on how people do. The nice thing is it's less frequent than neuropathy from chemo or febrile neutropenia or some of the other things that we see as a result of chemotherapy.
Your thoughts?
Yeah, no, I completely agree, and certainly the PD-1 and PD-L1 inhibitors are really well tolerated. They do have some different toxicities, which Leora mentioned, that patients need to be aware of, in particular pneumonitis, and I think those are important symptoms to bring to attention of docs, and they need to be investigated and patients put on steroids if there is evidence of that. But certainly compared with some of the other immunotherapies such as ipilimumab, those toxicities are much less frequent, and the drugs, even in older, frailer patients, are tolerated really well.
It's important just to underscore that early identification of a toxicity and addressing that, whether by stopping the drug or initiating steroids in some patients, is critical. So I think the biggest challenge would be if patients don't mention it and docs are oversubscribed and are not attending to it. But hopefully, as everyone gets more experience with them, we'll know what to be looking for and asking about.
Exactly.